Colorectal cancer remains one of the most significant malignancies worldwide, and while we have seen encouraging declines in older adults, the rising incidence among younger individuals continues to draw concern. My name is Dima Biccinetti, a postdoctoral research fellow in the Department of Family Medicine at Mayo Clinic, and I'm happy to share highlights from our study entitled Antibiotic Use and Colorectal Cancer in Olmsted County, Minnesota, which will appear in the April 2026 issue of the Mayo Clinic Proceedings. Over the past decade, attention has increasingly shifted toward factors that may influence the gut microbiome, given its relevance to inflammation, immune regulation, and colorectal carcinogenesis. Antibiotics, which are widely prescribed across outpatient and inpatient settings, are known to produce lasting changes in the microbiome. And because microbial disruption has been linked to various pathways involved in tumor development, there has been a long-standing question: does antibiotic exposure contribute meaningfully to colorectal cancer risk? The literature to date has been mixed. Some large observational studies, especially from Europe, have reported modestly increased risks of colon cancer with higher cumulative antibiotic exposure, particularly in the proximal colon. Others have shown no association at all, and a few have even suggested a possible inverse association in rectal cancer. These contrasting findings highlight both scientific uncertainty and the need for studies using comprehensive population-based data. Understanding whether antibiotic exposure plays any role in colorectal cancer risk has important implications not only for clinicians making stewardship decisions, but also for patients who receive antibiotics for legitimate clinical indications. We conducted this work using the Rochester Epidemiology Project, which is a unique population-level resource that allows us to track complete medical records over time. We identified 512 colorectal cancer cases diagnosed between 2010 and 2020 and matched them to 1,942 controls based on age, sex, and county residence. We examined all systemic antibiotic prescriptions beginning in 2005 and ending 2 years prior to each participant's diagnosis or index date, categorized cumulative exposure as none or 0, 1 to 15 days, 16 to 60 days, and more than 60 days of antibiotic exposure. And we fit conditional logistic regression models that we adjusted for the Charlson Comorbidity Index, smoking, alcohol abuse, and years at risk. This design allowed us to capture real-world antibiotic exposure over many years while minimizing the possibility that early cancer symptoms might influence prescribing. Across our 4 categories of cumulative exposure, the none, 1 to 15 days, 16 to 60, and more than 60 days, we found no significant association between antibiotic use and colorectal cancer risk. The adjusted odds ratios remained close to 1 across all exposure levels. Tumor site-specific analyses, including proximal, distal, and rectal sites, likewise were not significant, while directions of effect were modestly positive for proximal colon and neutral to slightly inverse for distal and rectal sites. The estimates did not reach statistical significance. An age stratified analysis suggested an inverse association among individuals younger than 65 years for shorter cumulative exposures, 1 to 15 and 16 to 60 days of antibiotic exposure, a pattern that was not observed in adults aged 65 years or older. This finding should be interpreted cautiously, as it may reflect differences in healthcare utilization, residual confounding, or chance. Class-specific assessments for penicillins, cephalosporins, Fluoroquinolones and tetracyclines did not demonstrate significant associations with colorectal cancer risk. Importantly, these subgroup findings do not alter the main conclusion, which is in this US population, Olmsted County, Minnesota, cumulative antibiotic exposure did not increase the risk of colorectal cancer. What differentiates our study is the Rochester Epidemiology Project's comprehensive medical records linkage across an entire geographically defined population, enabling consistent capture of diagnoses, procedures, and prescriptions over time. This approach reduces exposure misclassification and facilitates rigorous matching by age, sex, and residence, which is difficult to replicate in fragmented claims datasets or single system electronic health records. And while this is informative, it is important to emphasize that these results come from an observational study and we cannot establish causation. Clinicians should continue to follow principles of antibiotic stewardship aimed at preventing resistance and preserving microbiome health. The next steps for this research include replication in larger, more diverse populations, integration of microbiome sequencing and functional profiling to clarify potential mechanistic pathways, deeper examination of indication, timing, and repeated or early life exposures, and also evaluation of host factors that might modify any antibiotic microbiome cancer relationships. We also see value in multi-site analyses that apply consistent exposure definitions and washout periods, as well as designs that link prescribing to dispensing and adherence data to minimize misclassification. Thank you for taking the time to learn about our study. We invite you to read the full article in Mayo Clinic Proceedings for detailed methodology, results, and interpretations. We hope that this work contributes to ongoing conversations about antibiotic use, microbiome health, and colorectal cancer prevention.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.